Here in Arkansas and across the U.S. in memory of the 500,000 plus Americans who have died from COVID-19, more than 5,000 of them here in Arkansas. Testing for COVID-19 is picking back up following the snowstorm, so that, of course, means new cases of the virus are being identified. In the last 24 hours, about 4,500 people have been tested. Of those, 834 Arkansans came back positive. Another 14 deaths have been reported, bringing the death total for the state to 5,377. 545 Arkansans are hospitalized currently, with 99 of them on a ventilator. THV11 is also tracking vaccine usage in our state. As of today, the state has received 855,000 doses. Of those, 62% of them have been given out. The Biden administration is stepping up efforts to build trust and reduce reluctance toward the vaccine in communities of color, awarding $17 million to nonprofits for education and outreach. Distribution and supply shortages remain another big challenge. Drug company executives testified on Capitol Hill about efforts to step up production. Later this week, FDA vaccine advisors are expected to consider Johnson & Johnson's single-dose vaccine.
We are ready to begin shipping immediately and deliver enough single doses by the end of March to enable the vaccination of more than 20 million Americans.
According to the latest figures from the CDC, more than 82 million doses of the COVID-19 vaccine have been delivered. French researchers are developing a new rapid COVID-19 test that connects to a smartphone to reveal results right at home. CBS's Ian Lee reports from London.
Ever since the pandemic began, researchers in France have been working on a way to test for COVID-19 quickly and accurately.
So since March, we try to develop a portable device which everybody can use at home.
The research at this French university started, oddly enough, with camels, llamas, and alpacas. Scientists took tiny antibody particles from the animals called nanobodies. After some complicated science, they produced a device that plugs into a smartphone. A nasal or saliva swab is placed onto a strip, and if nanobodies come into contact with the virus, the test will know it.
And you start your mobile phone and a signal will occur, and depending on the height of the signal, you can say if you're COVID positive and negative.
Researchers say initial trials of 300 samples were 90% accurate and delivered in 10 minutes. Creators of the Cordile 1 test say if it receives approval, it'll be cheap once manufacturing begins on a large scale, ultimately putting another weapon in the arsenal against the virus. Ian Lee, CBS News.
The next phase of the project is to run a 3-month trial on more than 1,000 people.